Welcome to Save Your Thyroid with Jennifer Holcomb. This is the show where we dive into personal stories, professional expertise, and the latest non-surgical alternatives for thyroid nodule care, helping you navigate your health journey with confidence and keep your thyroid intact. In today's episode, I'm speaking with Emily, a patient who recently chose nanosecond Pulsed Field Ablation, nsPFA. This is a cutting-edge, non-thermal approach designed to reduce thyroid nodules without the need for traditional surgery. Emily is joining us to share the full story of her experience with this breakthrough technology. If you find these stories helpful, please take a moment to subscribe and leave a review. Your support helps this information reach others who are looking for safe, thyroid-saving alternatives. If nsPFA is a new concept for you, I encourage you to check out my previous interviews with Dr. Ralph Tufano, Dr. Richard Harding, and Dr. Emad Kandil. These are leaders in this field and explain the specific science of nsPFA, how it differs from thermal methods like RFA, and why it's such a significant development for patients. Links to those episodes are in the show notes below. Today, however, we are looking at things through the patient's eyes. Emily is here to give us an inside look at the procedure, her recovery, and her personal results. Let's get started. Welcome to the show, Emily.
Thank you. Thank you for having me.
I always like to start off by asking a patient, when did you first figure out something's not right? I think I have something going on in my neck, when you had that realization and the diagnosis of the thyroid nodule?
So for me, I actually was made aware of it by having unrelated imaging done. I had a weird back thing. I'm not as young as I used to be, and I was having some imaging done, and they said, "Ma'am, are you aware that you've got a pretty significantly large nodule on your thyroid?" And I said, "No, I did not know that." And they tried to kind of pull me off the ceiling a little bit. And they said, "Well, nodules are not terribly uncommon, but we do want to refer you to endo because it is kind of like a larger nodule."
Right.
And so that's actually how I found out that I had one. I was previously unaware. I know what and where-ish a thyroid is, but I had no idea that I had a nodule until that time.
Did you have any signs or symptoms? Once you became aware of it, that's a lot of times when people start to realize, that's what I'm feeling.
Exactly. Yeah. Well, my sister's a dentist, and I was telling her kind of the centimeter size they said it was, and she said, "Emily, that's like you should feel that. Like, can you?" So I was able kind of to feel it once she gave me some guidance for where I was feeling, but actually I became aware of it not only from feeling it, but it actually kind of started growing in size pretty rapidly after that. I met with endo. They did some preliminary biopsies, and it actually grew a little bit larger over the course of the next 30 days or so, where you could physically see it. So I
Wow.
became increasingly aware of it pretty quickly after that time.
Do you know how large it was?
I believe when I first met with an endocrinologist, I was living in Baton Rouge at the time, and I just met with a local endocrinologist there. The first time they measured it, it was about 3.2 centimeters, and they did some preliminary biopsying, and we were going to kind of sit tight. But over the course of the next 30 days, I could tell it was growing larger. And after about a month, they did another ultrasound. And at that time, it was about 3.8 centimeters. So it had grown, pretty significantly just in that short amount of time. Again, that was right after I had done that unrelated imaging and found out about it.
So you went for these consults with the endo. How did you end up from there to deciding you needed to do something about it? Because you're concerned, or what were their thoughts about it?
I met with them preliminarily, and they did an ultrasound, took some measurements, did some biopsying because it was not just super tiny, a little on the larger side. They did some biopsying. The first one came back indeterminate or something, so they had to do a repeat fine needle biopsy, send that off to California or wherever. It came back benign, so that was good. I was happy to sit tight, but for that, it continued to grow pretty rapidly over the next 30 days, like I said, and it was about 3.8 then at the next ultrasound appointment. At that time, because of its size, because of its clearly growing, it wasn't stable, it was clearly growing. At that time, the endocrinologist put me in a referral to general surgery for a consultation for a partial or full thyroidectomy at that time. And that all was like a whirlwind. I mean, I went from like being totally unaware of a nodule to, okay, you'll be getting a call within the next 7 days from, general surgery scheduling your consult. And so I kind of was like needle off the record. I was like, surgery consult, thyroidectomy. And she was like, oh, it's just a consult. It's like, yeah, well, what do you think a general surgeon's going to consult with me about? It's going to be about
Right.
surgery. There was really no discussion of alternatives at all in that.
Mhm.
I mean, I'm sitting in the ultrasound room, sitting on the edge of the bed, and it was just like, I'll put in your referral to general surgery. That was kind of the beginning and end of that conversation. So I went home and was kind of somewhat spiraling because I'm like, okay, they're going to take out my vital organs. Like, that's where we're at now.
Yeah.
Fully functioning organs. All of my blood work showed that my thyroid was working, was doing a wonderful job, doing its job. And so I didn't know anything. I'm not medical. I'm a lawyer. I don't do anything medical, but I just started Googling, which can be scary and not recommended. But in my case, I came across, and they weren't even articles that were written for me. It was more like scientific, I don't know, clinical case studies and things,
Mhm.
some content, and was finding out information about thyroid ablations, and came across Dr. Kandil's name again. At the time, I was living in Baton Rouge in South Louisiana, and he was based in New Orleans. And I was like, I've got to check this guy out. Like, what do I have to lose at this point? I know what the surgeon is going to say. Let's do surgery. That's what surgeons
Right.
like to do. And so, of course, they're going to want to do that. So I really didn't have anything to lose. So I read a little bit. It sounded like a interesting and promising option for me, knowing nothing about any of it. I sent a message to the endocrinologist, and she said, because I needed her referral from her, and I basically said, no offense, but I have to check this out. This seems like something that I should at least inquire about, see if I'm a candidate for. So she willingly put in a referral for me, said keep me posted. And so I scheduled my first appointment with Dr. Kandil after that.
And so when you saw Dr. Kandil, did you already know that you were going to ask about nsPFA, or were you just wanting to know about ablation technology in general?
I wanted to know about, I guess, about ablation. I didn't know anything about any of it. And I was reading,
Mhm.
and the content that I was reading was not really targeted for me as an
Yeah.
audience. It was for someone much smarter and more medically minded than me. But keywords were bouncing out that I'm like, this seems like something I should check out. So it was more just general thyroid ablation, non-surgical. These were all things that I was seeing. I was coming across Facebook pages for Save Your Thyroid, and I was seeing a couple of names bouncing around. And again, one of those names, probably in the top 5, was Dr. Kandil, that I kept seeing repeatedly, and he was an hour away from me. And so I knew I had to check that out. And when I met with him, I took the position of, this is who I am and this is what I have going on. You're smarter than me. Tell me what you think I should do, and I kind of let him make some recommendations for me. Again, knowing that as far as I was concerned, I didn't have anything to lose with trying something alternative. Worst case scenario, I guess we'll take my thyroid out. I can't imagine
Yeah.
anything worse than that, so why not try this other option and just see if we have any success with it at all.
That's amazing. So I just want to touch on your journey, like through research momentarily, because that was my experience as well. Reading through all this medical literature that is absolutely, as you said, not intended for patient consumption. It is oriented towards medical. They have a working knowledge of all the jargon, the terminology. It is not outside of their wheelhouse, right? But this is completely outside of the average patient's wheelhouse. And so that is the entire reason why I started Save Your Thyroid, is to put out there some kind of information that was oriented towards patients, because I was in the same place looking for content online that was oriented towards me, that I could understand, and there not being any. You said did you come across Save Your
Yeah.
Thyroid and join it?
Release a
Yeah.
Facebook group or something like that online, seeing a few, just reading some stories for other people that have had similar journeys. It's so brand new. And of course, there were some people that were flying to, I don't know, Turkey
Right.
or all over the
Yeah.
place. I've got 2 young kids. I mean, at this time,
Yeah.
I was still like a breastfeeding mom, and I had a 3-year-old, and I'm thinking like, I can't go to Turkey. Like, like,
Yeah.
that's not, realistic for me. And I just thought it was a God thing that Dr. Kandil was right there. And for me, that was like, I have to do this. This is what I'm supposed to do. And
That's awesome.
I still just had to have confidence in myself and be an advocate for myself, because I was clueless, but I just knew that there had to be another option. I was a healthy, fit, 37-year-old, like, I'm just like, why are we talking about, it just seemed bizarre. It seemed absolutely
Mm-hmm.
bizarre that we were going to meet with a surgeon about taking out my thyroid. And
Yeah.
I knew that could not be right. I know that may be the standard of care and that
Mm-hmm.
perhaps appropriate medical recommendation based on, I don't, red tape or whatever they're supposed to recommend. But it just, I couldn't go that way. So I really had to advocate for myself and do some research. And you want to walk that line between, of course, trusting your doctors and not Dr. Google, but your actual doctors. But in my case, I was glad that I came across the content that I did come across, the Facebook pages, the medical jargon that I didn't fully understand, just enough to let me know there is something else out there that we should look into here. And it was an enormous success. And so I'm grateful for my own self to be my advocate. I'll toot my own horn a little bit. And I'm so excited to be on your show and to know that people like you exist, to let other people know, wait a minute, look into this before you have your thyroid taken out. They can't just put it back in, once.
Yeah. Right.
So, and I know that as advanced as medicine is with hormone replacements and things like that, it's not ever the same. I mean, I've never heard of anyone who says, yeah, I'm on thyroid medication, but it's just, I don't feel any different. Like I know it's not going to do the job that my thyroid is doing for me right now. So I'm very grateful that I've been able to hang on to it.
Absolutely. Well, I'm excited that you were able to find what you needed. And tell us about the conversation you have with Dr. Kandil about what was the motivation for him recommending this particular technology for you, because he offers other technologies as well. So
Well, I know it's newer, and honestly, I don't even know if I can answer that question. Dr. Candle probably tell you why. I really just trusted him to make the recommendation. Now, I know he did, I believe he did a combination on me of this nanopulse and a little bit of chemical ablation as well.
Mhm.
I had some cystic spaces that I think that means fluids filled
Mhm.
space. I think there
Yep.
was like a little bit of ethanol perhaps used to kind of target those more fluid filled spaces. And then the nanopulse really targeted more of the solid places within the nodule. But yeah, so I don't exactly know why that was the ultimate recommendation that he made. I do know that he is a surgeon, a wonderful surgeon, and he could take it out if it really needed to come out. So I thought he was a really great resource, and I felt very confident in his decision because I knew that if he wanted to do surgery, he could. If he felt that this alternative was a good option, he could do that too. He has no reason to choose one over the other versus what he genuinely believes based on his experience and his knowledge and his research would be the best option for me. So I really just let myself fully trust in him to make a recommendation for me because he's smarter than me, and I knew I had seen his name a lot. And I could tell just from talking to him in our first meeting, he was very passionate about about this as an alternative option to surgery. I could sense his frustration right there
Yeah.
along line as far as seeing me with a healthy, working, wonderful thyroid, knowing that
Yep.
was just going to have it taken out, and how many people walk the road and trust their doctors, and they get a call in 7 days from the appointment lady scheduling their consultation with the general surgeon, and they meet with the general surgeon who recommends the surgery, and next thing you know, it's on the books. And so you show up and you have the surgery, and then it's gone, and you don't really have a chance to stop and to even realize, how did I get here? You
Yeah.
just putting one foot in front of the other. So again, sometimes my spiraling gets me in trouble, but in this case, I'm so grateful that I stopped long enough to go to look down a different path and follow that path instead. Put one foot in front of the other in that direction, because it easily could go a different way, and I'm not any better than anybody else because of that. I just had a minute to do some Googling and then found myself here. So very
That's a
grateful.
really important point, though, that you make. Because how many times have patients just been sent for that surgical consult? And then, like you said, it's like, oh, well, let's get you on the schedule for surgery. And you don't even, it's like you said, you don't even have time to think about it. You don't even have time to process, you're going to take out my thyroid. That means for the rest of my life, I need to take thyroid medicine. Why do I need my thyroid removed? There's just so much happening in those moments where you're just rushed through it. And then there's a lot of regret when patients don't stop and think and do the research. And so, kudos to you for doing your research, for getting a second opinion, for taking that extra step towards advocating for yourself, because I tell people all the time, no one is going to advocate for you better than you. And
Right.
so, that's awesome that you did that. Hey, just a quick break to share something I'm really excited about. My brand new website, saveyourthyroidwithjen.com. You can head there to subscribe to my mailing list and stay in the loop about new podcast episodes, videos, and updates in the world of thyroid nodule care. And I'm now offering something new, one-on-one patient navigation services. If you're feeling overwhelmed or unsure about your treatment options, I'm here to help. As a patient who's been through this myself and spent years learning from some of the world's leading experts in thyroid nodule treatment, I can help you make sense of your choices and feel more confident in your next steps. You can learn more about patient navigation and everything else I'm working on at saveyourthyroidwithjen.com. Now back to the conversation. So you chose Dr. Kandil's as a second opinion. He gave you his insights on treatment, and he did, you think, a combination of ethanol ablation and nsPFA. What I'm thinking, and this is just my layperson opinion, what I'm thinking happened when you said you had the initial biopsy and then it grew. I think maybe you had a little bit of a cystic, like a portion of the nodule, that the cystic component grew after that initial biopsy, because solid nodules take a really long time to grow, but cystic parts, they can grow like immediately. And so that would have been the part he addressed with the ethanol. So that makes sense.
Yeah, it absolutely, because for it to go from something I was not even aware of to I met, had an ultrasound, did a biopsy, and all of a sudden it was angry and it was big and it was gross. Yeah, I really think, like you say, I think that it just kind of probably had some bleeding and just some inflammation within the nodule because of the trauma of the two biopsies, really, because remember the first determinant, so they had to go in a second, and is several needle sticks with each biopsy. So I think, I think it just made it angry, and that cystic stuff started expanding because of that.
Yeah, that definitely can happen. I had a situation where my nodule grew really, really rapidly, and it was because the inside of it was filling with blood and the compression and everything. You can feel that in the neck so much more because it's such a small area. And so you're noticing these changes in your anatomy because there's lots of structures in the neck that are so vitally important. You've got the trachea, the esophagus, all the nerves and blood vessels and veins that run through your neck, plus your spine. So, there's so much going on in this small area. So little changes can really, really add up in terms of your symptoms.
They started to be able to feel pressure in that area. It doesn't help that once you're aware of it, at least in my case, tend to run a little hot. And so it would trigger my anxiety. And, sometimes when you have anxiety, you get that sense already. So you've got that lump in your nervous tightness plus a, almost 4 centimeter lump, literal lump in your throat that you're experiencing. So it definitely became uncomfortable. Never luckily affected the function of my thyroid, which
great.
Was good, and still has not, even post procedure, I'm still having really great readings as far as thyroid function. So that's all wonderful.
Excellent. Well, take us through the procedure step by step. What was it like? You went in and what was your pre-procedure and post-procedure? Because I know during the procedure, you probably don't remember.
Yes, no, that's right. So when we decided or Dr. Kandil made his recommendation, sent me home to think about it. It was definitely not rushed. It was not calendared that day. He sent me home to think about it. And I called back a couple weeks later and I was just like, I don't know what we're thinking about. Like this, to me, this is a no-brainer. I've got this thing that's angry and growing, and I didn't want it to grow such that this became a non-option for me. I wanted to tackle it. It was large, but not so large that it would have to be surgically removed. So I felt like I wanted to strike while the iron was hot. And again, didn't feel like I really had anything to lose. So I calendared, they had an appointment available. It was actually my birthday, my 37th birthday. They had a slot available. I said, well, this will be my birthday present to myself. Unfortunately, in my case, insurance didn't cover everything. So I said, well, whatever. This is my birthday present to myself. So I got to the hospital early that morning for, I think I had to be there at like 6:30 or something. I made some notes. I got gowned up. They started an IV. I met with Dr. Kandil's nurse, Wendy. She came in to check on me. Of course, the anesthesiologist came in to check on me. And they rolled me back a little after 8 and I guess gave me the good medicine that helps you fall asleep. I remember Dr. Kandil popping his head in and I briefly said, "Hey, Dr. Kandil, happy birthday to me. Hope you had your coffee." Quick interaction with him, but the last thing, yeah, that I remember was counting backwards from 10. I don't exactly know how long it took, maybe an hour or so, but I remember waking up being groggy, scratchy throat, and I think I left the hospital around 11. So I don't know, maybe an hour or so back there and a couple hours in post-op. But I had a Band-Aid. I had a little Band-Aid on my throat. I was sore. I mean, I don't want to be like, oh, it was nothing, because it really kind of was nothing, but I was sore. But I think it was from my understanding is like the positioning of the procedure. They kind of crank your neck back a little bit. So when you in your late 30s, you just sleep the wrong way for a few minutes and you're
Right.
all next day. So anyway,
Yeah.
I was kind of sore through my neck and chest and had some swelling through my neck and down even into my chest. Had some swelling all through there. Very minimal bruising and then a tiny Band-Aid. So I was like, I would complain about it, and my husband was like, "Oh, you just have a Band-Aid and stuff." I was like, I am sore though.
Yeah.
Cut me some slack a little bit." But it was really nothing. In fact, in 3 or 4 days later, we flew to Puerto Rico for a family vacation. So, I mean, it was not
Nice.
there's not some lengthy recovery period, I took the Band-Aid off and
Mhm.
good to go. I had some, a little bit of bruising and of course some localized swelling once the extended swelling, which was minimal. You could not tell. I could kind of feel it, but no one else could tell that there was any swelling through my neck and chest. But that all went down and had some mild swelling in my neck and some mild bruising. Um, but I wasn't hoarse. I was hoarse probably that day, and that could just be from I don't know if they intubate you. I don't even know the
I
answer
don't
to that.
believe they do. I think it's just all through the IV. But the fact that, all this is happening right near your esophagus, it's not unusual
There's
for people to have some of that. Yeah.
So I was a little bit hoarse that day. So don't let that freak you out if you're hoarse. Your voice is not going to sound like that forever. I can still talk and sing and scream at my children, when but we had a great vacation in Puerto Rico, and it was kind of a nothing burger on the back end of it. So
Um,
it was an easy procedure and happy birthday present to me. The hospital staff put a little printed happy birthday piece of copy paper on the wall behind my bed, so I got to celebrate there with Doctor.
I remember now, you sent me the picture and I saw it in the background of the room. That is quite the birthday gift for yourself. Especially if you consider that having had the alternative would not have been a very
Exactly,
nice birthday gift.
not at all. That and
My goodness.
I wanted to do it. I thought, you know what? Worst case, I've got a Band-Aid. I've had a great cocktail today. We're just going to see how it goes. Kind of roll the dice on this, and it'll be just an expensive cocktail, if nothing else, if it doesn't work. But like I said, I've
Mhm.
had wonderful results actually. So I'm super happy
Let's
with how.
talk about those results then, because that's the part that's the gift right there. So
Yeah,
tell us
absolutely.
what you experienced in your follow-up.
So my follow-up was actually a little less than 6 weeks later. So a pretty quick turnaround as far as follow-up. And at that time, as far as the total volume, there was over a 65% reduction in total volume in size in
Wow.
6 weeks. Yeah. So couldn't ask for better than that. Of course, you want to try not to get your hopes up, but I probably did have my hopes up because we all want to do that. And I could tell it was gone. I mean, when I first met with Dr. Kandil and his nurse Wendy, they didn't have to say, "No, which side is it on?" I mean, you could sit there and you could look at me and you'd say, "Oh, well, you have a lump in your neck right here." But I could tell it was gone. So when I went in, I knew. I said, "You're going to have good news for me because this lump is gone it's gone from my neck." And but it was wonderful. The results made me very happy. I think made the whole team over there super happy. And then I went back again another post-op in November of that year. So my birthday's in April. My procedure in April. June was my first follow up with this over 65% reduction in size. And then November, I went again for a second follow up. And at that time, there was, I think it was 82% reduction in size.
Yeah.
Yeah. And I'll go again in May. We'll check on things
Mhm.
again in a couple of months. Obviously, 82% reduction in size is,
That's
you know,
amazing.
they're that home run, a good birthday present and absolute success.
I'm just curious, did you go back to that endo?
I did follow up with her respectfully just to let her know that it was what my experience had been like, just to
Mhm.
this is something that I would encourage her to at least mention to, to other patients that
Yeah.
perhaps like me have a functioning thyroid, no other issues or health concerns that would make you need to quickly jump to surgery to make
Mhm.
it as an option. So I certainly hope that I really hope they'll change the standard of care to I mean, everyone should know this is an option. Let somebody else tell them it's not. If that endocrinologist isn't sure or not, say, "Go talk to this person and see if it's an option."
Right.
Because, when and I know there's insurance and medical and money and all the things. But when you think about what are insurance companies paying for thyroid medicine for the rest of your life and all of those,
Mhm.
absolutely, we need to look at the system here and say this could be saving everyone money and resources and time and of course, quality of life and just enjoyment of life and feeling good. There's not a price tag on that.
Absolutely.
I definitely did follow up with her.
Well, was she receptive to it? Like, how is she responding?
Yeah, she was. I mean, she said actually that she had had a couple patients in the past that had mentioned to her about this other alternative option, whatever, and that she had said, "Yeah, let me know how it goes," and she had not heard back from them. And I told her, "You will hear back from me," and she did, I did follow up with her to let her know how it went, and she seemed happy. I mean, happy that I had gotten good news. Now, however much that's actually incorporated into her practice, I don't know, but I certainly hope that this research is going to be continued to be promoted and pushed and the practitioners will absolutely start to incorporate it into their practice because it is life-saving, real life-saving. I may not be in critical condition, but I still consider it life-saving when
Quality of life saving. Yeah.
absolutely.
And hopefully you've planted a seed with her, the the future patients that she'll see, hopefully when they have the same conversation with her, she'll remember that you had this done and these other patients that have come to her that went and had other non-surgical techniques applied in their situation. Hopefully she will be willing to share that information and not just refer to surgery, because unfortunately we do see that a lot
Right,
where if it's not something they offer, then they may not mention it.
right,
But then, I feel like it is a very mature thing for a physician to do, to say, I don't do this,
right.
but I know someone who does, and I'm going to point you in that direction. And I love that when that happens. So,
Absolutely.
I think the next question is I think I know the answer to the next question, which is, do you feel like you made the right choice?
Well, yeah, 1,000%. I told Dr. Candle, I said, "Please tell me what I can do." And I'm so glad that I guess he gave you my information or whatever, contact me to interview, I don't know. But I just said, "How can I help you advocate for this?" Because it's wonderful. And I know it's medicine that he believes in. He's seen the power of this medicine. And certainly people that have had the procedure have. And so I just don't want to gatekeep it, because it's wonderful. And I know there's going to be so many other people with these nodules. They're not uncommon, and I just hate for people to start taking those steps in the other direction when there's an option like this available to them for sure.
Absolutely. They're saying now up to 80%, 70 to 80% of people have thyroid nodules now, which
Mhm.
is unreal when you think about how many people are going in and finding out, incidentally, like you did, like I did, that they have a thyroid nodule, and then they get sent off for their surgery consult. And my surgery consult was very much he was very cavalier about it. He was like, "Yeah, we can take it out, we can leave it alone, whatever. It doesn't matter. Thyroid doesn't matter. It matters a lot. It
Yeah,
matters a whole lot."
right.
And I think that your advocacy for yourself, caring about the advocacy of other patients, that is just a testament to that. It's not a throwaway organ. It's a vitally important organ that interacts with every part of your body. It interacts with your brain, your heart, your bones, your muscles, your digestion. Your thyroid function goes down, your cholesterol goes up. It's like dominoes go knocking down. So I think it's awesome that you feel like you've made the right choice here. And that when you make a choice like this, as you said, when you choose a non-surgical technique, you're not burning the bridge to surgery. You can always have surgery, but it's worthwhile, in my opinion. I'm assuming in your opinion, to try that first. So what are some crucial lessons that you, aside from that you feel other patients should know about in this area?
Listen to your doctors, trust your doctors, but not blindly. Don't turn your brain off. Use their brain as a resource and use your own brain as a resource, and trust your gut too. Do some of your own research and meet with someone smarter than you and maybe smarter than your first doctor and say, tell me why this is a good option or why it's not. And then you make a choice on what feels right for you. Knowing everything, seeing other options, then you choose what makes the most sense for you. But I think it's just walking that line between trusting your doctors and your team and looking around. And that's kind of good advice, I think, for all areas of life, is trusting these people, but just looking at the other opinions and other options available to you, and then kind of choosing where you think you fall.
Absolutely. I agree 100%. I feel like it is always good to get different perspectives. I do consults with patients where the patient wants to know, what doctor should I see? Who should I go see? And I'm like, well, you could get an opinion from this doctor. He's an endocrinologist. You could get an opinion from this doctor. She's a surgeon. And then this doctor is an interventional radiologist. They all have different perspectives and they all can do some of these non-surgical techniques. It's always good to get different perspectives because they're going to have different knowledge and skills that they bring to the table. And in your situation with Dr. Kandil, he has the surgical background. So it's an option if you need it. And then also the non-surgical options. So they're all tools, right? And so having access to tools is an important thing. So I always tell patients, if you want to have a true assessment of your situation, you can't expect someone who doesn't do this procedure to be able to give you that. You need to be able to talk to someone who actually does it to know if you truly are or are not a candidate. Because I hear from patients all the time, oh, my endocrinologist says I'm not a candidate. Really? Does your endocrinologist do this procedure? No. Okay. So if you need to find a doctor in your area who does one of these procedures, go to saveyourthyroid.org. And at the top of that screen, click Find a Physician. We have a list that we constantly update all of the physicians in the world that we know of who do these procedures. That is a free website. It's not sponsored by anyone. No one is paying to get on that website. It is a truly free resource for patients only. So I have one more question to ask you about your procedure. And was there anything about it that really surprised you? What was the most surprising or unexpected part?
I think is that all I got was a Band-Aid. I don't know why. I felt like I had the hospital gown. They put me to sleep. I'm at the hospital. I felt like I should be, I don't know, bandaged up or something. And I just got, which is a good thing because that's how, I guess, non-invasive it is. But anyway, all I got was I felt like I needed like a t-shirt that said, I've had weeks of, consults and appointments and ultrasounds and biopsies and now, ablation, and all I've got was this Band-Aid. But
that's a fantastic idea.
My biggest surprise is that all I got was a Band-Aid.
Oh, we need to make a t-shirt that says that. I love that. Oh my goodness. Thank you so much, Emily. I'm excited for you having had such a wonderful outcome. I'm thrilled that you were able to save your thyroid and that you had such a wonderful experience. So thank you today for sharing your experience with us.
And thank you for the work that you do in your advocacy in this community. It is, like I said, it's life-saving work. You, Dr. Kandil, his whole team, it's all life-saving work. So thank you for the voice that you give the community and the interwebs, so people like me can find people like you and help us find people like Dr. Kandil. We appreciate it.
Thank you so much. That wraps up today's episode. If you found this valuable, please like, subscribe, and share it with someone who might benefit. You can find links to everything we discussed in the show notes below. Find a physician, discover treatment options, and join our patient community at saveyourthyroid.org. To stay up to date on new episodes, resources, and expert insights, be sure to subscribe to my mailing list at saveyourthyroidwithjen.com. It's the best way to stay connected and informed. There you can also find all podcast episodes and book a 1-hour patient navigation consult for personalized guidance on your next steps. As always, please remember this podcast is for informational purposes only and is not a substitute for professional medical advice. No endorsement is given or implied for any specific product, treatment, or physician mentioned. As always, consult with a qualified healthcare professional for your individual needs. Thanks for listening, and I'll see you next time.